this morning about the long-term impact of COVID-19. A new study shows that in some cases, the virus can attack the brain, resulting in long-term neurological effects. NBC News health and medical reporter Erica Edwards joins us now with more on these latest findings. Erica, good morning. This is sort of a scary one and one that I know we keep slowly learning more about. So walk us through this new report. We've heard of COVID impacting a patient's lungs, of course, but tell us exactly what it can do to other parts of the body, including the brain, and what effect it has, especially long term.
Yeah, hey Savannah, good morning. So first of all, this research is considered quite preliminary, but it suggests that the virus can impact the brain directly going through the nose, which makes sense, right, considering all the people who lost their sense of smell early on.
Professor at the Hackensack Meridian School of Medicine and Director of Autoimmune and Rheumatic Diseases at St. Joseph Health. So Dr. Bob, let's stay on this topic of long COVID. What have you seen in patients who are still dealing with symptoms weeks, even months after initially contracting the virus?
Well, Joe, probably the worst case was a patient that we saw about 8 months after being infected, a young man in his early 20s who could not even press the gas pedal or the brake pedal in his car. He couldn't steer, and his father had to bring him to the hospital or for his appointments. We're seeing everything from loss of taste and smell to the chronic brain fog that you heard about, fibromyalgia-like symptoms, inability to sleep, headache, shortness of breath, lots and lots of joint pain, and overall fatigue in general. So it's been a real slog for these poor people who continue to suffer.